morning. I'm Erin Maltsby, one of the dietitians here at the office. Nice to meet you.
Nice to meet you.
I'm going to be conducting your physical exam today to assess your overall health. And this is going to involve me touching you in a professional manner. Do I have your permission to do that?
Yes.
Okay. So first, I'm just going to kind of do an overall assessment. So have you had any shaking or stumbling when you walk?
No.
Okay. Have you lost weight in the last 3 months?
No.
And how would you rate your scale of how you feel overall, from 1 being awful to 10 being excellent?
10.
Okay. Any concerns or anything I should know about your medical history?
No.
And as I'm completing the exam, if there is any tenderness or muscle aching areas I've touched, please just let me know.
Okay.
So first, I'm just going to assess your skin quality. So I'm just going to check for moisture in your skin. I'm going to use the back of my hand to check for temperature. All that is good. Now I'm going to assess your hair quality. So I like to check to see if there's any thinning in the scalp. I like to make sure your hair is full of moisture and that doesn't break off easily. And that just tells me if you have any vitamin or protein deficiencies. Now I'm going to use my fingers to palpate your temples to see if you have any scooping in the temple region or if you have anything that indicates muscle wasting there. And now I'm going to take my fingers and do the same thing underneath your eyes to assess to see if you have good fat storage under your eyes, and that also indicates for good muscle. And I'm going to ask you to look at the tip of my fingernail and follow with your eyes. And now I'm going to assess your lips, tongue, gums, teeth. So stick your tongue out for me. Good. I put your tongue back in and I'm just going to check your gums and your teeth. All that looks good. Normally if I see any lesions or cuts or your mouth is really dry, that's something we need to be concerned about, but you don't have any of that. Now I'm going to ask you to sit up nice and straight for me. I'm going to check your clavicle region. Just going to press in here to feel for muscle wasting there. All of that feels good. I'm going to check your shoulders. They're nice and rounded, so that's good too. And now I'm going to ask you to stand for me. Ask you to extend your arm at a 90-degree angle. Okay? I'm going to take my hands and feel for your muscle, and then feel for when they disconnect and where I can feel the fat, and that is good. You can put your arm down for me. And now I'm going to ask you to make an okay sign with your hand. And I'm just going to check here for muscle, and that is good. And I'm going to ask you to, don't let me break the circle. Okay, good. You can put your arm down. Now I'm going to check your nails. I like to see if the color returns to the nails within the first few seconds of me doing so, and that just lets me know you have good blood flow and circulation to your extremities. And then I like to make sure your nails aren't scooping underwards for protein deficiency, and those look good there. Put your hand down. Now I'm asking you to turn around for me. I'm going to check your scapula and the back of your regions here. Make sure there's no depressions. Then I'm just going to feel for your ribs. Make sure there's no depressions or that no bones protrude. I'm going to feel the iliac crest in the lumbar region. All of that feels great. Okay, you can sit down for me. Now I'm going to ask you to extend your leg for me just a little bit. And I'm going to feel your thigh, make sure that the muscles are defined and firm. That's good. I'm going to feel your patella region. All of that is good. There's no protruding there, the muscles are firm. I'm going to feel the posterior side of your calf, and the muscle is supposed to be in a bulb shape, so all that is good. And I'm going to go down to your ankles, and here I'm checking to make sure you don't have any edema, which is fluid that can build up from malnutrition. And I'm just going to stick my finger on your ankle, and the color should return to normal within a few seconds. That is good. Your feet have good color, and so do your toes. So all of that is good. All right, so overall, I consider you to be a very healthy individual. No indications for malnutrition or muscle wasting, and I think everything looked good. I appreciate your cooperation and being patient while I completed the exam. Do you have any questions for me?
I don't.
All right, then it was nice to meet you. You can exit
Thank
this way
you.
through the lobby. Have a great day.